Continuamos con la charla, Revolucionando la ecocardiografía con IA para POCUS, eliminando barreras en el diagnóstico cardíaco en atención médica, presentada por Pedro Martínez Clark, CEO de Amavita Heart and Vascular Health, una propuesta transformadora que acerca la tecnología al corazón del diagnóstico clínico, allí donde más se necesita.
Buenas tardes. ¿Quién de aquí no habla español? Are you guys comfortable with Spanish, English? English, perfect. So thank you so much for inviting us to this meeting, wonderful meeting. The level of innovation that we've seen in the Cardiovascular Foundation is incredible. I'm originally from Colombia. I'm from Barranquilla in the coast, but I live in Miami. And I lead a cardiovascular practice in Miami, Florida. And I was asked to talk about the impact of artificial intelligence in cardiovascular medicine. And we could talk about that for hours and hours, but I wanted to bring just a few examples that I think are very relevant, and specifically talk about echocardiography, because I think that's one technology that we can bring to Colombia and to remote areas where we don't necessarily have huge cardiovascular infrastructure. So the rise of artificial intelligence in cardiovascular medicine is huge. It definitely helps us with efficiency. It helps us with precision. It just makes us better cardiologists in general. And it allows us to access more patients because it allows us to set up remote diagnostic locations where technology can be readily accessible to patients. Just to give a few examples of some of the technologies that we use today in daily practice, this one is a stethoscope. This is a smart stethoscope that as you auscultate the patient, you're going to hear a specific alerts that will tell you that the given patient has a valvular heart disease or has a problem with the heart pumping function, meaning the ejection fraction. That's very, very powerful, just by auscultating the heart. It also allows you to do arrhythmia detection, and as you may or may not know, arrhythmia detection in cardiovascular medicine is huge because of atrial fibrillation and the association with the strokes. Another example is the diagnosis of coronary artery disease. I do interventional cardiology, which means that I place a lot of stents in people's hearts, in arteries, and veins, etc. But today, when you have the possibility of having coronary artery disease or a blockage in one of the arteries of the heart, before we take you to the cath lab and do a diagnostic angiography, which is an invasive study where you get access to one of the arteries, take pictures of the heart, etc., we take a CT scan of the patient and we put this image through a software algorithm. And this is called CT-FFR. And what that does is measures the severity of a given blockage in a specific area. Anything that is less than 0.8 is abnormal, meaning that you can have a blockage, but it doesn't mean that is hemodynamically significant. So in other words, you can have a lesion in a coronary artery, but you might not need a stent necessarily. So by putting your heart through this CT scan analysis, we can know exactly that, for example, this lesion is 0.69 and this lesion is less than 0.8. That lesion needs a stent, and we do the cardiac catheterization, and we know exactly what we're going to do before we do the procedure. So this is very, very powerful. Another one is the use of artificial intelligence to diagnose early coronary artery disease. And this is very important because a lot of the heart attacks occur in people that are younger than 55 years of age. So some of the heart attacks occur in patients that have what is called soft plaque, meaning cholesterol buildups that are soft in characteristics. These are lesions that are 30% in severity. you can't really see them in a regular CT scan, etc. So we use artificial intelligence in a CT scan model to diagnose and predict and identify lesions that are very soft and that they can rupture. So imagine if I can tell you that 5 years before a heart attack occurs, you can, do things to change your lifestyle, take medications, whatever. This is also very powerful. And the one that I want to talk to you today in a little more detail, which is one that we want to bring to Colombia, is the use of artificial intelligence in diagnosis and interpretation of echocardiography. How many of you are familiar with an echocardiography? Some? Okay. All right, so basically this technology is called ASAP, and it's the only one, the only FDA-approved technology that has a diagnostic algorithm to interpret echocardiographic images. So I'll show you in a second. This is basically point-of-care echocardiogram. And I brought this back for a specific reason, and it's to show you. As you know, an echocardiogram is a huge machine that can cost $100,000, $200,000. You need to train a sonographer, has to go to school for a year, 2 years. The sonographer obviously has a cost. Here I have an echocardiogram machine. So I'm going to show you the two different workflows. Today, if you go to see a primary care doctor, and then let's say that they refer you to a cardiologist, you wait, 2 weeks, 4 weeks for the appointment. Then you're going to see a cardiologist. They're going to order an echocardiogram, which is a very basic test that we do in cardiology. You're going to have to wait 2 weeks, 4 weeks, whatever it is, to go get that ultrasound. You have to go somewhere to get the echocardiogram. You as a clinic, you have to buy this huge machine, this one here, and you have to buy also a service package for the machine, etc. And it takes a few weeks to get the echocardiogram appointment, and then those images go to a reading room, and a cardiologist sits there and reads images. So the whole cycle might take, 4 weeks, 6 weeks, 8 weeks, 12 weeks, depends on where you are. What we're proposing is to shorten that workflow. In our example, you come to see me, for example, and at the first time that I see you, I pull out this tablet, and I pull out this handheld device, and this is the echocardiogram. That's it. And you can have that in any remote location. And this is extremely powerful. We use it in daily practice now. And I can't imagine practicing cardiology without this tool anymore. This is really, really amazing. I'll show you. So what this does is really improves the workflow, decreases cost, and really makes your echo lab be a lot more effective, efficient, because you want your echo lab to be doing studies in patients that are sick, that really need advanced imaging to be able to really use the resources that you have at the institution. If you look at the current cost of some of the machines, the Vivid series can range from $100,000 to $200,000. Philips can range from $150,000 to $250,000. And you get the point, they're very expensive. In our platform, you basically take this tablet, and this marker gives you a signal that the images that you are acquiring are correct. So you don't have to know echocardiography to be able to get those 4 images that we need. 4 images, that's all we need. And the software does all the work. So basically, I can train any of you guys in an hour to do an echocardiogram. The data that you get from this study is obviously not the same and the same that you get from a huge, amazing, high-fidelity machine, but it's good enough to give you an idea of what you're dealing with and allows you to triage patients and make medical decisions on the point of care. And if you look at all the parameters that we are able to obtain, these are really important parameters that allow us to make medical decisions. Left ventricular function, valvular heart disease, stenosis, regurgitation, tells you about the inferior vena cava. Imagine evaluating a patient that is hypotensive, and you do one of these point of care ultrasounds, and you can know right away if it's a cardiac issue, pulmonary issue, volume depletion issue. It's very, very powerful. This is the first FDA-approved technology that does this, and this is data basically from the pivotal FDA trial that basically showed that the algorithm interpretation is better than the cardiologist. So just think about that for a second. The images that the machine, that the software analyzes, the interpretation is more accurate than the cardiologist. So I can take any of you guys, show you how to get 4 images, give you a little tutoring whatever for an hour, and you're gonna give me 4 images, and the report and the interpretation is better than a cardiologist. So that was demonstrated in a very important clinical trial that showed that it was better than 3 core labs or echocardiographic core labs. These are all the variables that are included in the study. I won't bore you with that, but they're here for your reference. And this is the data that was published that showed that if you give this tool to any practicing physician, so imagine in a country like Colombia, in small towns, whatever, you place one of these machines to every medical rural in Colombia, you give one of these machines, and amazing. And the data shows that you just make the physician just a better provider. In terms of clinical experience, it's been demonstrated that in about 30 to 40% of times that you use this, you're going to change your decision making. In other words, you're going to do something different that you wouldn't have done if you didn't have this data. You transfer the patient, you don't transfer the patient, you give medication, fluids, whatever. It allows you to do certain things like early discharge, reducing length of stay because your treatment is just better, optimizes the workflow, allows you to use certain medications based on data, avoid certain referrals, allows you to provide remote care, and it's all handheld, very cost effective. The whole system costs less than $4,000. This is an example that I did about 48 hours ago. This guy that you see here is a Colombian physician that is training with me. He's not a cardiologist. He just graduated from medical school. So he's just recently a medical student, hasn't gone through a specialty training. It's called a Médico General. And I gave him a demonstration, and I tutored him on how to obtain these 4 images in 1 hour. So here's the marker. It tells you that you obtained the images correctly. You might not know what you're looking at and what you're in, or the interpretation of it, but you don't need to. The software does everything. So it's able to give me all the data that I need. And this is how the display is reported. And this is my son. He's a high school student. He's 16 years of age. And I taught him how to get images. And he was able to get the images just after 1 hour of training. Same results. The scanning time, about 5 to 6 minutes. So pretty important. In the United States, we use Medicare. We have to follow all these Medicare rules. It's kind of the billing codes that we use. And the findings and the reports, basically, the output is in a format that is in compliance with the Medicare requirements for billing and compliance, et cetera. And this is the report that you get. And this is, the data that you need to be able to make certain decisions right there at the point of care. So, in summary, it allows you to provide better care to cardiovascular patients. It allows you to approach patients and care for patients anywhere, anytime. The tablet is, it doesn't matter the brand of the tablet. It's a software that is installed in the tablet. And it's a license, basically. And the handheld device can be any brand. It doesn't matter. We use Philips because of the resolution, but you can use any handheld echo probe. So basically, in summary, you can just train anybody, really, for an hour, teach them how to obtain 4 images, and those images are processed in the software, and the artificial intelligence, machine learning, processes those images and compares them to an active database of 2 million people, and that database keeps growing every day as more and more echoes are done, so the analysis is just really, really accurate. So if we empower the physicians or the providers, nurses, paramedics with this type of technology, their decision-making will be a lot better. And that's just the beginning. This technology has the potential to really revolutionize ultrasound or full-body ultrasound. You can do vascular, you can do abdomen, you can do CNS, you can do musculoskeletal, urology, so many different applications that this technology can have. Thank you so much, and I hope that you embrace this technology. Thank you.